nervous system. Scenario physician family dialogue. Setting emergency department ED. Physician, thank you for bringing your father in promptly. Based on the history you provided, a sudden unresponsiveness, difficulty speaking, and weakness on the right side, we are concerned that he experienced a transient ischemic attack, or TIA.
Family member. Is that the same as a stroke?
Physician, a TIA is often called a mini stroke, but medically it is different. A cerebrovascular accident, CVA, or stroke causes permanent brain injury. A TIA, however, is a temporary interruption of blood flow to the brain that resolves without permanent damage. However, it is a serious warning sign. Your father has several significant risk factors, including hypertension, which means high blood pressure, hypercholesterolemia, meaning elevated cholesterol levels, and a history of smoking. All of these contribute to atherosclerosis or plaque buildup in the arteries, which can reduce blood flow to the brain.
So this happened because of blocked blood vessels?
That is one possibility. Now, a small clot may have temporarily blocked a cerebral artery, then dissolved or moved, which is why his symptoms resolved.
You did a lot of tests. What did they show?
We performed a CT scan or computed tomography of the brain to rule out an intracranial hemorrhage, meaning bleeding in the brain. And to look for evidence of an acute cerebral infarction, which is death of brain tissue, which can cause permanent symptoms.
Did the scan show a stroke? We're worried. My aunt had a stroke and she was paralyzed throughout her life.
I'm sorry to hear about your aunt, but the CT did not show any hemorrhage or arterial occlusion, which supports the diagnosis of TIA. We also ordered an electrocardiogram, EKG, and echocardiography to evaluate his heart rhythm and heart structure. Because abnormal rhythms like atrial fibrillation can produce blood clots that travel to the brain. His blood work was mostly normal. However, his blood glucose was 220. According to the CDC criteria, a random glucose over 200 is consistent with diabetes mellitus,
But he never said he had diabetes.
this may be newly diagnosed. Diabetes mellitus is a metabolic disorder characterized by chronic hyperglycemia, meaning elevated blood sugar, which increases the risk of vascular damage and stroke.